There are two techniques in particular that are going to be very important in helping to alleviate subacromial impingement. One is to restore normal tissue texture and muscle resting length to the bicep, in particular that short head of the bicep, as it's attaching to the coracoid process. A dysfunctional bicep is one of the most important muscles to treat for shoulder pain and particularly for subacromial compression. Our goal when applying a myofascial technique to any short, tight muscle is to draw the tissue away from the origin towards the insertion to restore this normal muscle resting length. Soft tissue release is then applied to the distal end of the bicep. To mobilize the bicep and the enveloping fascia, a rotational movement can be used. This can then be applied in the opposite direction, internal rotation with a medial lock, and the arm is then externally rotated. The second technique will involve manually decompressing or pushing down the humeral head to bring it back into a more centric or centered position within the glenoid fossa. In order to grip the client's arm securely, the therapist places their caudate hand under the client's arm to grip the ulnar border, so it's little finger to little finger. Each hand then applies a pressure in opposite directions. Once the humeral head is moving freely, it can be felt dropping down and the acromion will actually be more prominent. These are advanced techniques and should really be performed by a qualified myoskeletal therapist. So what can the client do themselves at home to help alleviate this condition or to maintain the effects of therapy? Probably the two most important techniques will be to stretch the bicep and to decompress the humeral head to maintain that centric position of the humeral head within the glenoid fossa. Stretching bicep is a little bit more complex than it might initially appear. Most people, when they try to extend to stretch their bicep, they substitute scapular motion for true arm extension. So important to coach the client and tell them that they should really concentrate, even practice this looking at a mirror, concentrate on keeping the scapula back and down, even monitoring this with the fingers of the other hand. The arm to be treated then can be reached back, and we can use an object like the back of a chair to provide just a little bit of extra stretch. It's important that this stretch is not overdone. If we use too much force on this stretch, the muscle starts to guard, and we now have got muscle shortening instead of muscle lengthening. Using the Aaron Mattis method of active isolated stretching, we're just going to hold for 2 seconds. So we reach back, use an object like the chair to deepen the stretch for just 2 seconds and then release. Although you're only holding in 2-second increments, you will repeat the exercise 10 times to give you a total of a 20-second stretch. If you wish to stretch for 30 seconds, you simply increase the number of repetitions to 15 and so on. The position of the hand can alter which part of the bicep is being stretched, and it's good to alternate and see where do you feel it most, starting with the palm back, palm in towards the side of the body, palm facing forward, palm facing out. For me, today, I feel it most with the palm facing forward, so that's the position I'm going to stretch in today. This may change. As the muscle starts to respond to stretching, you may find that other positions start to meet a different restriction as your range of motion increases, and you can alter the stretch to stretch the tight portion of the muscle on a given day. The second part of our home care is going to involve the use of a stretch rope, stretch strap, or a simple yoga strap. This is going to be placed over the top of the humerus. And it's important that we don't have this sitting on the shoulder cap because then we'll just be pulling on the entire shoulder girdle. Instead, what we want to do is to be able to pull down and pull the humeral head down. We're going to do this with a little bit of movement, very similar to the manual therapy technique that we saw in our myoskeletal techniques. So here I'm going to pull down on the humerus and roll the arm back and forth. We can release and then pull again. Because the tissue is somewhat viscoelastic, it helps to hold the stretch for a little while and then give it a small amount of rest and repeat the maneuver, mobilizing the joint and the surrounding tissue. I hope you enjoyed this short video on subacromial impingement and found it useful. If so, don't forget to like the video and subscribe to our YouTube channel. If you're interested in finding out more about training or our international seminars, you can find details on our website. It's hcd.ie. And if you'd like us to travel to your area to provide a seminar, you can get in touch with us by emailing info@hcd.ie. Hope to see you soon. Thank you.
Have you considered becoming a certified specialist? It's a tangible marker that your services meet nationally recognised standards of excellence, enabling the public to make informed choices when looking for a massage therapist or myotherapist. The opportunity to become a certified specialist is open to all therapists nationally. For more information, visit massagemyotherapy.com.au/certification.
G'day folks, Dave Sheehan here from Connect. Really excited to have Rob Granter with us today. Welcome, Rob.
Thanks, Dave. Thanks very much.
Now, Rob, I consider that I've been in the industry for a little while, but I reckon you supersede that by a little bit. So how have you become so good at what you do for so long in the industry? Because a lot of people talk about burnout and so on. So it's been a while that you've been in the industry. So what's the tip on that?
Oh, look, it's a good question, Dave, and it's something that I've always, thought about, because when I first started doing, as it was then, it was remedial massage, was when I first started, and I was pretty small. I'm not very big now, but I'm a bit stronger than I was, when I first started. But I was over enthusiastic and underdeveloped in terms of a human being to withstand the forces of remedial massage. So actually, I did injure myself quite early in my career.
Yep.
So therefore, I was really forced to think about, how am I doing? How am I doing the work? How can I make it more effective without overloading myself? So technique was really important. My fingers are very, very small, so I had to be very, very careful about how I was using my body, and always also using body, patient positioning to advantage as well. So making sure that not always just working in one position, that we get people in more functional positions or positions that make you feel more effective in terms of the force that you are delivering.
Do you think back then colleges actually they put any emphasis on the self-care aspect, or not at all?
No,
Zero.
Yeah. So it was good for me when I started teaching to make that a huge priority, because it was. Here I was thrown into the industry without that sort of information, and I became injured. So I was really, really careful to, and still am to this day as an educator, to convey those those important points.
Yeah, sure. So let's talk about the timeline. So when did you start in sort of the soft tissue industry?
About 33 and a half years ago.
Okay.
Yeah.
So am I allowed to ask these sorts of questions?
Of course you can.
We're comfortable about that?
We're totally comfortable.
Good.
We're mates, Dave. It's good.
Okay, and whereabouts did you study?
I studied at RMIT, and I was the very first group of students when RMIT took that on as a course, put that on scope, whatever it was, 30 years ago when we first started. It was a 3-year full-time course then.
Wow.
So in fact, on the initial intake, I missed out. I put my application in, but I missed out on the selection, and my lovely wife Christine wrote a impassioned letter saying that this person is so committed and passionate to do this. Can you please rethink your criteria and let him in? And I got a phone call a week later saying you're in. So that was a long, long time ago.
So that was what was then called, that was remedial?
Certificate of Applied Science, in brackets remedial massage.
Wow. And it was a 3-year course?
A 3-year full-time course. Yeah.
So would that be not dissimilar to musculoskeletal degree, myotherapy degree, that as far as structure, or apart from the self-care aspect that you mentioned?
As far as time is concerned, yes, but as far as structure, probably no. I think we've got that a bit more sophisticated these days.
Yeah. Was it more hands-on and less theory-based, or do you think?
Look, in those early stages, because we're the very first group through, it was, I think the lecturers were finding their feet as well. So, in fact, a lot of us were quite frustrated, year one, that we hardly touched each other. We're thinking, didn't we sign up for a massage course here? So, but we certainly got into it, as time went. Yes.
Okay, and then you progressed into myotherapy at some stage?
So whenever RMIT changed the qualification, it went from a certificate to a diploma of remedial massage, and then a
advanced
associate diploma.
Associate, okay.
Was it? I'm just trying to think of my... Anyway, and then to the advanced diploma. But opportunities to upgrade at every sort of stage of the way.
Yeah, okay.
And I took that on.
And what do you see the differences between myotherapy and remedial therapy? What do you see the differences as?
Well, from an education point of view, purely the education from the diploma of remedial massage to the advanced diploma of myotherapy, there's added modalities of mobilising, MET, exercise prescription, myofascial dry needling. So even discussion on the use of electrical modalities as well. But again, a remedial massage therapist that's been really, active in terms of their PD can be functioning exactly as
skilled
a
up in all those other
absolutely, yeah. So
sorts of ways.
in terms of at the coalface, at the clinical, the person might see no difference whatsoever in the skill set because that person's really worked hard to bring themselves up to include those modalities.
Yeah, okay. And as far as the actual industry and what the general public, the punters out there, are concerned about as far as what we do you think perceptions have changed somewhat, or do you think back when you started that they went to see Rob the masseur? I hate that word, masseur. Anyway, so do you think
masseuse is worse, as a male?
True. Yeah. Okay. Yes. So do you think the perception of what we do has changed? I guess with the general public, but also within the allied health as well. How do you think people see us now? Where do we fit?
Yeah, I think very much so, Dave. I think well, I was one of the first people to get into a multi-modality clinic in Melbourne, probably in Australia at the Malvern Sports Medicine Clinic in Ashwood. So we were really paving some new ground here. So there was a lot of obstacles to overcome. So, but I see now, especially in Victoria, I think from an outsider's perspective, I think remedial massage and myotherapy have got really well-established reputations, and I think we're doing a super job. The association, supporting their members, and I think that's I think we sit in a really comfy position here in terms of being held in high regard by other health practitioners and the general public.
I know from a Massage Myotherapy Australia perspective, being a director as well, we see a focus now being put on with member funds to really concentrate efforts in, I guess, expanding and exposing our members to, for instance, GPs for referral. So there's been quite a significant investment in getting brochures into GP clinics all over Australia. So things like that seem to be, I think, cranking the wheels a little bit for us.
Absolutely.
And they're all helping. So let's just talk about Olympics, because you've just done some amazing stuff over your career. So do you want to talk a little bit about your experiences with Olympic soft tissue teams and whatnot?
Absolutely. It's certainly great experiences, and for many ways it was a life-changing experience. That I'd been a punter, an averaged athlete. In fact, my biggest athletic success was the Western Victorian slot car champion.
What's a slot car?
Slot cars when you.
Oh, you mean scale electrics?
Scale electric. Well, they were bigger and faster than scale electrics, but that was my passion as a 14, 15, 16-year-old.
So did you get sort of repetitive strain injuries and that sort of thing from
it was,
driving?
No, it was, but it was fun days.
Yeah.
We went from almost Mildura to Melbourne to Geelong to Hamilton to Ballarat, and with my dad as well. So it was really good stuff. So that was the extent of my athletic endeavours. I always loved to be fit and active, but in terms of achieving anything of great substance after leaving school, it wasn't. I was an okay athlete. So to be at an opening ceremony with in the middle. My first Olympics was Barcelona. I can still remember it as clear as day. Now being in the middle of an oval with 10,000 of the best athletes
in the world
at the time, and you're kind of you're on the inside of that whole process. It was like I was kind of very emotional and still emotional. The impact that has on you as a person, thinking, I think I've really done something special here, and and I just loved it. It was hard work in those days.
That was going to be my next question. Like, it must be, they get you their pound of flesh, no doubt.
Yeah, in those days, the philosophy was if an athlete wanted treatment, you treated. So you started virtually whenever they wanted, and you kept going until the list ran out. And then you crawled home and had some sleep and you got back again. So, we were doing 20, 25, 28, athletes a day. And we did that for something like 23 days in a row, so it's just...
That'd be rough on your body.
Yeah, it's almost inhumane, activities. But again, that idea of being, so concerned about my body health and technique and body positioning and that sort of stuff was super important. So, but when I took over as head of soft tissue therapy services, going to Atlanta in '96, then I made it really clear that everyone had very strict guidelines that they could, and they could only be available for these times. And
Yes.
there was breaks, there was days off, there was, so you can enjoy the experience and to make, because you're giving your services free of charge. It shouldn't be it shouldn't be a horrible experience. It should be a wonderful experience. So I really ensured that we brought some occupational health and safety measures into, so that every person could really enjoy it. So
that's brilliant. That's fantastic. And what would you consider one of the highlights of all of your experiences with teams? Because you did Commonwealth.
Yes.
And you worked
Games.
at VIS too.
Yeah, VIS for many years. Lots of highlights. It's.
Have you been following any particular or treating any particular athlete that that people may know of over the period?
Well, particularly now, it's great to look back and see some of the athletes that that we were working on. Nicole Livingston. Nicole was a very person that I worked with many years, and now she's running AFLW.
Yeah.
There's so many of the other athletes that are taking really important roles. You see people like Hayley Lewis, who I worked on. You see Hayley in the media doing that kind of work in another another sort of format in terms of a lifestyle program. But they're doing really well. You see a lot of so lots of those athletes. Michael Klim, Matt Welsh, Debbie Flintoff King. A lot of those people are really important, strong leaders in our community and giving back lots of things, because they're really. And the great, I suppose, the highlight of the fact, athletes get a bit of a bad rap sometimes, but they're people that are motivated to get out of bed and do something.
Sure.
Which we've got to respect the fact that they're just self-motivated and to a large extent just really, really wonderful people. Yeah, fantastic. So I think the highlight was just being able to be around people like that really motivated yourself to to be the best that you can as a therapist to support them as athletes.
Okay, fantastic. Good. Now let's change topic for a minute, because Rob and I have spent the better part of the day here. We've been filming some new webcasts, so we better give that a bit of a plug.
Great.
So we've done 2 so far. We've got another couple to go, probably on another day. But did you want to explain to the punters what the webcasts or the webinars are all about?
Yes, thanks, Dave. Yeah, so the association's just approached me to put some webcasts together with Dave to just especially focusing on clinical assessment. And the first one we've done is talking more about how we can do a comfortable but accurate subjective examination to our clients. So we've just taken ourselves through a flow chart that we can use in the clinic, and we've got a downloadable PDF that we can use in our own clinics and use that as our standard form to get a bit of uniformity, because lots of different ways to do clinical assessment. We've used a particular way of doing that, which is a very thorough way of getting a really clear idea of describing the person's pathology that they're coming in with. So that was one we've done, and we've also done one on just getting accuracy with recording ranges of motion, because a lot of us have problems with recording accurate ranges of motion. So we've done a webcast using a goniometer and putting in some guidelines to make if we're looking at particular ranges of motion, being that as accurate as possible. So that's I think those things are particularly useful, and we're planning on doing some others that get a bit more deeper into the assessment processes, say the cervical spine. And
So looking at specific regions of the body.
yes,
And the abilities to assess accurately.
yes,
And also make some suggestions about treatment.
absolutely, yes,
yeah.
and using that assessment to choose an intervention and then check to see if that intervention is actually working by going back to your reassessment and seeing whether you've reducing pain and restoring optimal range of motion to those areas. Yeah.
One of the questions that was written for this interview today was about giving maybe a tip for people about assessment. What can you offer the guys at home? What should they be looking at? What's a good tip?
Well, they could be, logging in and looking at our Halo.
Of course they should be.
Platform, Dave, and
Exactly.
looking at those sorts of things. But I think the association generally is, with the conferences, with the recommended workshops that are being offered to members. That's a great place to start. This idea of just being interacting with as many possible people as we can. I know in my circumstances that certainly helped me that go to as many reputable workshops as possible. That the online resources we've said, making sure that we look at really reputable sources of our information as well, because we didn't have this, Dave, when we started the net, which is as we know is an extraordinarily good resource, but it's also an extraordinary cluttered resource as well. So we'd love anyone to be a discerning learner in terms of this sort of stuff. So when you go into YouTube,
It's true, not just if it's online, it doesn't mean necessarily that it's good.
No,
that's what you're saying.
And even from some resources that look like they're quite reputable, they can just be giving you the wrong information. So the important thing is to, using textbooks like Clinical Sports Medicine as a starting point. That's the great thing about that book. It's written, largely in an Australian context, even though now there's a lot more worldwide. But Clinical Sports Medicine, into its 5th edition, is a great place, a reputable place to start. And then you can even go on YouTube and look at those same authors, see what presentations that they deliver. So and follow some of the key people that come up in the association that we see. I think for me, working in clinics was really good. It was difficult because I started in a sports medicine clinic with sports medicine doctors and physios. So it really was.
You had to step up.
Yeah, it was quite stressful, initially. But you just saw the potential if we did step up and did gain that reputation with those people, how much that would be good for our industry, but also good for for me as a career choice to support my family. So
now, in the past, you've run workshops yourself. Are you doing workshops at the moment, or?
Yes, we are doing the occasional workshop. So we certainly plan to do more workshops this year. We also try and run at least once a year a little mini conference, which is nice because it's not a full day conference. It's just an evening from say 6 o'clock to 9 o'clock. So when we get a number of speakers to come, and it's a nice.
What month is that?
Well, it could be any time. We've just had our last one in May. We had Joanne Elphingston from the UK and her partner Ken Firth come over from Cardiff. We also had a physiotherapist who runs a clinic in Baldwin, and he's a great supporter of soft tissue work. He's got lots of myos and remedial massage practitioners on his staff. So and a person that runs a really good workshop in terms of getting all the practitioners together and sharing information.
Lovely.
So they're the environments that I think we want our members to work to. I think, again, we want to make sure that we're working in places where our skill set is valued. So if that's not where you're at the moment, I think you're doing life pretty hard. So I'd look around for some opportunities, where your skills are really valued, and you're going to love going to work and get a lot more fulfilment out of it.
Yeah, fantastic. Well, Rob, we'll leave it there. If people want to find out a little bit more about your little mini conference or any of your workshops, we're going to pop the website up just down under here somewhere. So that's all good. Rob, thank you again for joining us. and being a supporter of the association as well over the many years. And we need to get you to conference soon.
Great.
It's probably about time, eh?
And thank you for all your support and all the great work you've done for our industry, Dave. Thank you very much.
Thank you. Okay. Folks, that's it. We'll see you next time.